please.
All right, you guys are live.
Wrong.
Recording, streaming. Yeah,
Okay.
you're good. You're live.
So we should talk about 2 hours right now.
Well, I think we can.
Well, thank you very much for, I know you were here last time, and so you're pretty familiar with the program, and this is our quarterly forum where we go through program data and talk about the program, answer any questions about the program, and an opportunity for discussion about any issues. So, as you're aware, the program is called Gateway Hope. It's our syringe service program run by the County Health Department. It's been in operation since August 2017. It's a harm reduction program, and it was designed as an evidence-based response to our local public health emergency related to rising hepatitis C infections due to the sharing of needles and injection supplies. So the goals of the program are to reduce new cases of hepatitis C in Tippecanoe County, prevent an HIV outbreak in Tippecanoe County, provide safe disposal of syringes, and importantly serve as a path to treatment by linking participants to drug treatment, healthcare, and social services. The program currently runs out of 3 locations. The Health Department office on 6th Street, which is on Friday afternoons, and then 2 mobile sites. One is at the Lincoln Center, and the other is at the I.D. Arnett Clinic on Greenbush. The hours listed for the Greenbush site are incorrect. It's 10 a.m. to 1 p.m. instead of 9 a.m. to noon. Later this year, the program is going to move from the Health Department 6th Street location to the new Lafayette Transitional Housing Center, which is on Union Street. And then also, we will be acquiring a new, larger mobile unit later this year. So the 2 exciting changes for the program coming this year. This next slide has a lot of numbers on it. This shows the syringe distribution and collection for the program from its beginning, which was August 11th of 2017 through March 31st of 2019. The program has seen a total of 373 participants over that period of time. The program has distributed 54,945 total number of syringes, and the program has collected 84,889 dirty syringes for safe and proper disposal. And these numbers are broken down further underneath here. For the syringes given out, we break the number down into the number of syringes given to new participants at their first visit, and it's 11,318. And also then syringes given out to returning participants when they come back in, turn in their dirty syringes and exchange them for clean syringes. That number is 43,627. On the collected column, we have the syringes collected from program participants. That number is 43,716. You can see it's broken down into the number collected from new participants at the first visit, and then the number collected at those returning visits. And then we also, as part of our program, one of the goals is to provide for safe disposal of used dirty syringes. And so we have a community drop-off where people can drop off dirty needles and syringes. And so we've collected a really large number for disposal, 41,173. So these are syringes that did not originate as part of our program, but that are brought in by community members for safe disposal. So we're very happy that these syringes are not ending up on the streets, in alleyways, parking lots, playgrounds, or even in garbage bags where they can injure the public. The 2 figures here towards the bottom of the screen are the return rates for syringes, and we include two different calculations of that figure. The first calculation is simply the number of syringes that we have collected from the program participants, 43,716, divided by the total number of syringes that we've given out, 54,945. And that ratio divides to become 79.5%, which has increased from the beginning of the program. Back in September of 2017, that figure was 52%. And here you can see how it's gone up gradually along the course of the program. The important thing to note about this number is that this includes syringes that were distributed to new participants during their first visit, this number right here, and it also includes syringes distributed at the end of the reporting period for ongoing harm reduction. So in other words, syringes that were distributed just before March 31st that would be returned and exchanged in the future, in April, so on and so forth. The second calculation of return rate is down here in red, and this is the one that is used by the Indiana State Department of Health. And so this number basically focuses on returning participants, so it factors out the new participant number and just looks at the number of syringes returned by returning participants, 41,719, and dividing that by the number given out to returning participants, 43,627, and that turns out to be 95.6%. The average for programs throughout the state of Indiana is 80%. So we're glad that our number is much higher than 80%. You can see how it's changed over time. There was actually a period of time last year where we were actually collecting more syringes than we were giving out. So we had a couple of 3 times where this value was over 100%. But 95.6% is still quite a good number for that. Our program also provides a lot of other important services to these individuals. Among those services are testing for hepatitis C and for HIV. And so we're happy to report that 82% of our participants have been tested for hepatitis C and 86% have been tested for HIV. I think that's a very important part of our program. We also provide very important linkages to care. One of our goals is linking participants with important substance abuse, mental health, health care, and social services they may need. And so this slide shows how many referrals for these services or services themselves we've provided. For substance abuse treatment, we provided over 500 referrals to substance abuse treatment programs. We've had 70 participants in substance abuse recovery. We actually have our own recovery coach on staff at the program, and she is able to provide these recovery services to our participants at the program itself. We've made almost 200 referrals to mental health service programs. We provided almost 900 doses of Narcan. That's the life-saving antidote for opioid overdose. So this is an important part of saving lives. We've done close to 300 STD, sexually transmitted disease tests, helped with insurance navigation for 130 individuals, provided close to 200 immunizations. Among these immunizations are immunizations for hepatitis A and for hepatitis B. Hepatitis A is another type of hepatitis for which there currently is a multi-state outbreak occurring, including in the state of Indiana. And are very important to us. We wanted our program to be a comprehensive response to the opioid epidemic and to provide services that many of these individuals may not get otherwise. Our program also includes a community cleanup where we have a team of volunteers that go out into various neighborhoods in the city and look for and pick up any dirty syringes they find. Between August 11th and 2017 and March 31st of 2019, they've only found 12 dirty syringes, but they have collected over 80 bags of garbage off the streets. It's another valuable service that this program has been providing. This next slide is very important, and this shows the new cases of hepatitis C in our county going back to 2011. And as you can see, starting in 2014, there was a dramatic increase each year in hepatitis C cases as the opioid epidemic set in and more people were sharing needles and other drug injection equipment. Our hepatitis C new cases increased dramatically. In 2017, they peaked at 176 new cases in our county. Our program started in August of 2017, and we're happy to announce that for 2018, we ended up with a total of 135 new cases, so a 23% reduction in new hepatitis C cases for our county. So this is a trend that we hope to see continues with each year. We hope to see this number drop further. So we think this is a very good indication that the program is working and that it's meeting its primary goal, which is to reduce the number of new cases of hepatitis C in our county. I mentioned that HIV, preventing an HIV outbreak is another important part of our program. We have been very fortunate in our county to always have a low number of HIV cases, and so with our program, our goal has been to keep that number low and to not see an increase in HIV, new cases of HIV. And as you can see, that number has remained low. 8 cases for 2018, there were 8 in 2017, higher the 2 years prior to that. So we hope to continue to see this number remain low. In other counties where they've had this problem, particularly Scott County, Indiana, where there was a huge HIV outbreak due to needle sharing, their HIV outbreak was preceded by a hepatitis C outbreak. So we wanted to intervene in this county early and prevent an HIV outbreak, and also decrease, of course, our hepatitis C cases. So just to review our 4 main goals for the program: reducing new cases of hepatitis C in Tippecanoe County, preventing an HIV outbreak in Tippecanoe County, providing safe disposal of syringes, and serving as a path to treatment by linking participants to drug treatment, healthcare, and social services. I always like to close with a quote or some other piece of information about syringe service programs. This is a great photograph that I came across from Philadelphia in 2012 that highlights the cost of problems like HIV and the economic impact that these diseases can have, and also the cost savings that programs like Gateway to Hope can have. Here on this one invoice that she's holding, it says one clean syringe to prevent 1 HIV infection costs 8 cents. The lifetime cost for HIV treatment for one person is $618,900. So for hepatitis C, the cost of treatment is not as high as HIV, but runs around $100,000 per person to treat hepatitis C. And it's important to realize with hepatitis C that that's the cost for treating the infection. Many people with hepatitis C never receive treatment. and they may go on to develop cirrhosis of the liver failure, and even death. And nowadays in the U.S., the most common reason for liver transplantation is hepatitis C infection. And I'm pretty sure that a liver transplantation would probably run somewhere in the $600,000 to $1 million range. So hepatitis C is also a very costly disease, whether it's treated early on or treated later on. And programs like this can really save society a lot of money. The American Foundation of AIDS Research states that for every dollar spent in a syringe service program, society saves $3 in long-term costs. So very cost-effective and an important public health measure. Those are all the remarks that I had. Be happy to answer any questions or clarify anything.
Yeah, one thanks for your presentation. I'm sorry that it's so big a crowd.
It's been good each time. I got to pay them, you know. So.
I'm just curious, so last time this data goes up to March 31st, what was the data range from the last meeting? What was the last date?
So the last meeting was through December 31st. We like to do these quarterly. We submit our data to the Indiana State Department of Health each quarter. And so the data for January 1st through March 31st was submitted to the state on April 15th. Yeah, and so we give the same data here. For the case counts in the world of epidemiology, the data usually lags behind by about 3 months. So during our last update like this, you might remember there was a little asterisk next to 2018 that said it was the preliminary data. You didn't have the final count in, but now that it's April, that's the final count from the State Department of Health. Could possibly go up by a few or down by a few if there are new cases that were diagnosed in 2018, but for some reason not reported until now. But usually there would not be much of a change past those months.
Okay, yeah, and I know I asked this last time, but I'm still interested. Have you guys seen a kind of wandful mobile unit to visit across the Ripple? Because I know from the police reports that I've been looking at, we've been seeing a lot more syringes picked up around campus.
Okay. Yeah, the West Lafayette City Council had expressed some interest in 2017 about possibly having a location in West Lafayette, but unfortunately decided not to pursue that. So for now, our locations are here in Lafayette. They're of course open to everybody in the county, whether they live in Lafayette, West Lafayette, or in the surrounding county area, Tippecanoe County.
Okay, so if there was like a hypothetical need in West Lafayette, would that take city council coming to you guys to ask, can you send a mobile unit over? Would that be something you guys to decide to deploy yourselves if you saw more students coming in?
Yeah, I think we would need approval from the West Lafayette City Council. If it was on the Purdue campus, we need approval from the university.
Okay, but since 2017, you guys haven't seen that kind of need, or at least the city council hasn't reached out to you again?
The city council did not reach out to us again.
Okay. And just last thing, you guys mentioned the safe injection handbook. I was wondering if you guys had like a PDF or something that you could like...
Yeah, if you give me your email, I can send it to you.
Yeah, that'd be awesome. Thank you.
It's one that we put together, so.
Awesome. Yeah, that's all I had.
Okay, thanks. Thanks for coming.
Yeah, definitely.
Did you get a copy of the slides?
Yeah.
Yeah, good.
Ooh, cool mouse.
Oh, thank you. Let me see if I can get my computer to work.